Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Hello everyone, welcome to another podcast episode of Healthy Chicago. Today with me I have a really special guest, Antonio Mercado, who's going to talk about the first Latino Health Summit happening in the country in the city of Chicago. Again, my name is Diego Vintimilla. I'm your host today. I work for the Chicago Department of Public Health as a Public Health Administrator 3 for the gay, bisexual, same-gender loving men, Hispanic, Latino experience in the Chicagoland area. Thank you so much. Welcome, Antonio. How are you doing today?
I'm doing great, Diego. First a guest and now a host. So you're moving up in the world. Right. Watch out, Dr. Ige. I'm excited here. My name is Antonio Cordero Mendoza Mercado. I'm here representing Project VIDA. And I'm a link-up coordinator focusing on harm reduction out in Chicago.
Great. Thank you so much, Antonio. And share a little bit more about yourself. Are you a Chicago native, a transplant?
I'm a Chicago transplant. I decided to stay in the heart of Chicago. So I'm in Pilsen right now.
Oh, wonderful.
And I very much love it. And Project VIDA is actually located in Little Village. So I'm very much loving being able to get to go and drive to work every day there.
So where did you grow originally?
So I grew up in Texas, and Pilsen reminds me a lot of Texas, honestly, and where I grew up. So I feel very at home in Pilsen. The murals, the art is amazing. So I really appreciate the art out here.
And I bet you can experience what is like the experience of a Latino, the contrast of Texas and Chicago and really specific neighborhood of Chicago that has the majority of Latinos, right?
Yes. And it's a breath of fresh air. From Texas, I love Texas, but Chicago is definitely more liberal out here and more welcoming and a lot more community, which I very much appreciate.
No, yeah, I feel what are you saying, because I am a transplant as well from South America, and it's such a wonderful and welcoming environment that you can feel in Chicago. And speaking about the environment, I think this is the perfect place to talk about what kind of resources you can find in the Health Summit, right?
Yes, yeah. So Project VIDA and a list of other organizations are going to be putting on a Latiné X Health Summit. That's happening on July 14th from 12 to noon. At Joe's on Wheat Street. So I hope to see you there. You can also register at shylhs.com to get a head count and also see a list of activities and things that we have planned for that day.
Great. And as far as I understand, the audience is same-gender loving men and is welcome to everyone, right?
Yes. So we are prioritizing queer, bi, Latino men, same-gender loving men. But this summit is for everyone. This summit will be fully bilingual, English and Spanish. So we're very looking forward to being able to offer that to the community. The services that we'll be providing there, again, you'll get a full list of things on the website, but we'll have free HIV testing, free at-home kits, dance classes, art classes. So not only all health-focused things, it's all around. And again, we are prioritizing queer Latino men, but this summit is for everyone and for everyone to come and enjoy and embrace those folks.
That's good to know that is a welcoming environment, because that's the final aim of the summit, sounds like. And in relationship to the services, they make a lot of contrast to close some health disparities that the gay Latino men experience in the Chicagoland area.
Very much so. And this is a community effort that's happening with this event. So we have over 15 organizations that are coming out to help us. The Latino Commission on AIDS, the Puerto Rican Culture Center,
Howard Brown Health, right?
Sinai Chicago. So and a list of so many other folks. So this is definitely a community effort. And it's going to be something really, really cool to see.
Yeah, and as far as I understand, in terms of community, there are different pillars within the Latinx Health Summit. As far as I understand, there's a health pillar, or like a main topic. There's another one focused on immigration, housing, and youth. Would you mind to tell us a little bit more about those?
Yes. So a lot of the programming is focused on youth, and we'll also have legal aid services for migrants as well. So really a plethora of resources for everyone.
Really holistic, it sounds like.
Yes, yeah. And not only all health based, like I was saying. So we'll have dance classes, art classes, ballroom, voguing, bachata, cumbia, merengue, live DJ. So again, it's not so much health summit. Well, it is health summit, but it's a way that we can talk about this and embrace all these things in a fun and engaging way.
Right.
And that's exactly what we're trying to do. We're trying to spread these resources and get people engaged in their health.
Right, and I think that's a problem that sometimes we encounter when we talk about health. Like you're saying, things get really like dry and like straightforward, and we can still talk about prevention or like any other kind of talk in relationship to harm reduction or something like that without putting so much blame or like negative feedback or talk.
Mm-hmm.
So this health summit sounds like a good approach to health and health quality of Latin men or same gender loving men.
Very much that. And I think in the Latino community and in the BIPOC community in general, there is a distrust with the health systems. And events like this, we're trying to bridge that and again, engage that population and get people excited about their own health and give them the right resources to do that.
Yeah, because connecting the community with the right resources is one of the main goals, I would say, with this health summit. As far as the services that are being offered there, the lack of resources, we are trying to cover that lack with the services that we're offering there. And as far as I understand, most of the community health leaders have brought up like concerns about what they are seeing within community, the Latino community or Latinx or Latine, and what are the main services that they need.
Very much that. And I think you also touch on something, Latine, Latinx, Latino. There's a lot of disconnect in the community. But what I love about the Latino community is that it's not all one. It's not all one person. It's not all one look. It's not all one anything. It's so many different communities, so many different races that make up the Latino community.
Ethnicities, yeah.
Ethnicities.
Right.
And this event is embracing everybody.
And speaking on that, following up on that, you're speaking about diversity. Latinos, we are such a diverse individuals, and our necessities are the same as diverse. So that's why it's important to have a multicultural approach and I would say holistic approach on health, because sometimes big systems don't really like see or understand how these necessities work within a person as a Latino.
And I think we do have so many differences, but we have so many similarities as well.
Right.
And events like this are looking to embrace everybody. Everyone is invited to the table, and everyone belongs at the table. So that's what we're trying to do with this event.
Yeah, and like not going far and beyond, speaking of differences, like you and I, we connect in a way like we both are like Latinos and we identify as Latinx. However, we have differences on other like levels, if that makes sense. However, in this big system, we are labeled as the same person.
White, Hispanic, yes.
Yeah.
That's how we're seen.
Right. So it's so interesting how the system works in relationship to that and how we can like close health disparities with the right resources within the system.
Very much so.
Well, something else that I wanted to bring to our attention in relationship to the Health Summit is how the structure has been working for you guys in Project VIDA, the logistics of organizing all this. How's the experience so far?
It's definitely been fun. There's so many cooks in the kitchen, so that's been great to work out. But like I was saying before, it's definitely a community effort, and we're getting buy-in from the right people and so many people. So I think it's gonna be so good, and it's also gonna to reflect that.
And I love that different communities of Chicago are represented in the summit because, like you were saying, Little Village and you are living in Pilsen, those two communities represent a lot of Latino population. However, there are different other communities that you can find other ethnicities as well, or like other Latinos as well. For example, Albany Park, or where's the Puerto Rican Cultural Center? Humboldt Park, I think. So like it's interesting to see how each community has their own necessities or they are uniques, and we are trying to cover those necessities in the summit to connect those community members with the right resources those are spread around the city. I bet you have experienced that working in Little Village.
Definitely that. And there's definitely a need for resources. And in Chicago in general, there's a need for resources. And again, events like this are ways that we can connect individuals to those. If you know someone, if you're friends with someone, if you're a family member, if you're not of the population, I think an event like this would be good to go to educate yourself, to just learn more about the concerns of us, because we're all the same and we're all going through the same things.
Yeah, and I just want to highlight as well that this is the first event of its kind happening in the country. So it's interesting if we think about a minority within another minority, because that's how the system pretty much label us. So if you see the LGBTQ plus community and then you see the Latino community or Latinx, we exist within that, but the LGBT plus community in this country is white represented pretty much, and the Latino community in this country and in Latin America is pretty much straight or heteronormative. So we're always kind of like pushed to the side. So we're trying to have some sort of like advocacy and like awareness that we exist within those two big intersections of identity.
And I think an event like this, where it's highlighting and embracing and empowering individuals that are experiencing that Latino, X, queer, same gender loving, bisexual, we're embracing all of that.
Exactly.
And we're prioritizing that, which is not seen, like you were saying, it's the first in the country, and everyone's invited. And again, this is a fully bilingual event, so anybody can come and experience everything.
Right, and to put it on perspective a little bit, you were saying you are from Texas. Let's talk about and compare about the services that you could find as a Latino queer individual in Texas. And I'm from South America. I could barely find that information over there, to be honest. There was none. So it's so interesting how Chicago is so welcoming and they actually foster this kind of like support. Do you feel in that way?
Yes, and I definitely think it's a lot easier and more accessible to receive services. Coming from Texas, it is a bit of a search. You have to go looking for things. It's very far apart. Resources are mostly in the big cities, so it's very scarce to find testing resources, prep resources. So I'm glad events like this can bring everything into one spot, and give access to folks in those resources.
And speaking about bringing everything into like one spot, health does not only like of course represents prevention, PEP, treatment, follow-up, doxy prep, but health represents mental health, holistic approaches to money maybe, or to insurance, because as a Latino individual, like we have to remember and we need to be aware that we have unique challenges in this system. So sometimes, as a queer Latin individual, finding immigration challenges or things related to finding services in Spanish or Portuguese or even like a clear English that is not like technical is hard because we don't have those tools yet.
No, I can definitely agree and see that as well.
Great. Well, moving forward, I just want to like go back to the point of the health. As you were saying, Antonio, health is addressed in different ways in the summit. Sounds like mental health, self-care as well, right?
Mm-hmm.
Can you tell us a little bit about the self-care panel as well?
Yeah. So again, there will be a plethora of resources, art resources, legal aid resources, harm reduction, so Narcan, fentanyl.
Oh, great. And I think the self-care panel is in relationship to what does it mean for every Latinx person, like self-care in relationship to hygiene or like, you know.
What would you say your self-care is, Diego?
I would say meditation and mindfulness. What about yours?
Long walks, I think. Long walks. Lakeshore is very nice too. So going out there. Or the Mexican Fine Arts Museum. Because that's right in my neighborhood. So
You're lucky.
That's a really, really great museum. So
yeah, I just walked over here today to like be chill too for the interview. So you're right. It works really well. And the Mexican Art Museum, sorry, would you mind to tell me a little bit more? Where is that located?
It's right in Pilsen. So it's not too far from Pilsen. And they do great exhibits and it's a beautiful space.
Well, great. Thank you so much for sharing all these resources, Antonio. I think it's really important to highlight again that the summit is happening in contrast to the Latino culture, which is the main goal of the summit.
Yes, yeah. And we really couldn't do any of this without the AIDS Foundation of Chicago, VIV Health, and the Department of Public Health. Again, thank you, Chicago Department of Public Health, VIV Health, and AIDS Foundation of Chicago, and all of the community partners that we've been working with, because this is a community effort and it's going to be a great event. Again, July 14th, 12 to 6 at Joe's on Weed Street.
Great. Thank you so much for coming up today, Antonio, to talk about the Health Summit. Thank you, everyone, for listening to us today. My name is Diego Vintimilla from the Chicago Department of Public Health, and this is another Healthy Chicago podcast episode. Follow us on social media. Thank you so much.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.